Hi everybody. Caregivers recently have been asking, can I refuse to care for elderly parents? Well, honestly, we can refuse to do anything, but in thinking about the answer to that question, there are a lot of considerations. I'm Pamela D. Wilson. My website is pameladwilson.com. In this video, there is a link to a blog post called Can I Refuse to Be a Caregiver? In life, not everybody wins the parent lottery. I had amazing parents, great parents. I was a very fortunate child, but not all childhoods are happy. This is part of the reason that some caregivers will ask, do I have to care for elderly parents? Can I refuse? Can I say no? The reasons that some of these issues come up is that when children are young, depending on your family situation, children may be given a lot of adult responsibilities. Some children are responsible for caring for their brothers and sisters when they are at a very young age. Imagine having that responsibility at age 6 or 8 or 10 or 12. Imagine being given a lot of tasks that your parents would be the ones normally doing them. Research shows that children who are in these types of positions, where they are forced to be older than they are at a very young age, experience the stress of caregivers in their 20s, 30s, 50s, all the way up to 80. What are those feelings? It's feeling burdened by responsibility. It's feeling stress, psychological burden, worry, resentment. And those young children at that very young age are already experiencing the physical and emotional issues that caregivers do many years later. This results in issues often throughout their life, and definitely issues when the time comes to care for elderly parents. Imagine being the caregiver that you are today, whatever age you are, and all of the stress and anxiety that you're experiencing today at 40 or 50 or 60. Imagine having that begin when you're 8 or 10 or 12 or 14 and carrying that throughout your life. That would be very difficult. Caregivers today, all ages, 20s all the way up to 80. There are caregivers who are millennials who are trying to build their careers and raise children and go to school, all the way to older caregivers who are in their 60s and 70s, caregiving for parents who were 80, 90, and 100 years old. Many of these caregivers at all ages are asking, can I refuse? Can I say no? The answer is absolutely yes. But caregivers then begin to balance feelings of guilt, feelings of, if I say no, will I regret doing this? If I say no, how will this affect my family relationship with brothers and sisters and with my parents? You can say no to differing degrees. Caregivers can set boundaries to say, anything on Saturday I can do, the rest of the week the answer is no. And it's okay to do that because you have to preserve your own mental and physical well-being. If you are going to totally opt out of that caregiving situation, then one of the best ideas is to set up a plan for someone else to care or help for your elderly parent, especially in situations where life and death situations and decisions have to be made, and they will be happening. So find a professional to appoint as a medical power of attorney. Find a professional to appoint as a financial power of attorney. Set up the situation so that there is someone else available to care for your elderly parent, or place your parent in a situation, in a care home, where there are other people to care for them, so that you will not have to be as responsible, and so you will not have to feel like you have to show up all the time, or sometimes show up at all. There are many solutions. I'm going to be talking about this subject on a future radio program. Visit my website, pameladwilson.com. There is a lot of helpful videos, articles, radio shows, podcasts, information for caregivers and aging adults, no matter what type of caregiver you are, caring for elderly parents or a spouse. Information is there. Have a fabulous day today.